Alright guys and gals, if you're looking at the screen, it says how Obamacare health insurance subsidies will work. Beginning in 2014, enormous insurance premium subsidies and payment supports will be available under the Affordable Care Act to millions of lower income individuals and families. Now, while Obamacare could always be overturned before then, the law has been upheld as constitutional by the U.S. Supreme Court, and short of the historic landslide victories in this November's elections, by the law's largely Republican opponents, changing major aspects of it will be extremely difficult. U.S. News spoke to officials in the U.S. Departments of Health and Human Services and Treasury, which have primarily oversight of ACA tax and subsidy benefits. They are producing a growing mountain of rules to implement the law. Beyond the ideological and financial disputes, the ACA is also an extraordinarily extensive and complex package. The law's consumer subsidies, premium tax credits, and help with out-of-pocket health expenses will be available to people who cannot meet its individual mandate to have health insurance, meaning they are unable to find affordable coverage from employers or other private insurance plans. Instead, they will turn to the new state insurance exchanges that are scheduled to be credited next year. The law says states can create their own exchanges or let the federal government do it for them. Many states, mostly those with Republican governors, are holding off on this decision until after the elections, though. Eligibility for supports will be determined by the relationship of individual or family gross income levels to the National Federal Poverty Level, FPL. In 2012, the FPL is $11,170 for a one-person household and rises by $3,960 for each additional family member. For a four-person family, for example, the 2012 FPL is $23,050. It increases each year due to inflation, so will be a bit higher in 2014. Higher health taxes have gotten much of the attention in the debate over health reform, but the law also includes two types of extensive financial help for lower income Americans. Under the ACA, individuals and families with incomes from 100 to 400% of the FLP will qualify for tax credits to reduce the premiums for health insurance purchased through the exchanges. In addition, incomes from 100 to 250% of the FPL also will qualify for help in paying out-of-pocket costs for the co-pays and deductibles not covered by their health insurance. Both of the assistance programs are tied to the development of standardized healthcare policies, modeled after the Massachusetts health reform law. These policies will be offered in 4 tiers: bronze, silver, gold, and platinum. To qualify for a tier, the private insurance companies developing these plans must promise they will cover specified percentages of the typical healthcare expenses for people covered by the plan. These actuarial value thresholds are 60% for bronze, 70% for the silver plans, 80% for gold, and 90% for the platinum plans. The silver plans have a special role in the tax credits and payment subsidies. In a state insurance exchange, the second cheapest silver plan will become the benchmark for tax credits. Using the cheapest plan might have led the insurers trying to game the system. Because healthcare costs differ around the country, this benchmark premium will not be the same in every state. However, the percentages of this premium that can be received as health insurance tax credits will be the same. They are based on a sliding scale of FPL percentages. People and families earning 133% of FPL, for example, will have to pay only 2% of their income toward the health insurance premium. They will receive the difference as a tax credit. The payment limit for those at 400% of FPL is much higher, 9.5% of their income, so their tax credit will be smaller. Here's the list of FPL percentages and sliding scales of income that people must pay toward their health insurance premiums. Up to 133% of FPL payments are 2% of income. 133% up to 150% of FPL payments begin at 3.0 and rise to 4.0% of your income. 150% to 200% of FPL payments begin at 4.0% and rise to 6.3% of income. At 200% to 250% of FPL, payments begin at 6.3% and rise to 8.05% of income. At 250% to 300% of FPL, the payments begin at 8.05% and rise to 9.5% of income. 300% to 400% of FPL, payments are 9.5% of income. So here are some questions as a guide to the Affordable Care Act. Why do you need health insurance? Where will you get health insurance in 2014? And mistakes to avoid when buying health insurance. In addition, how to get the most for your health insurance dollar, how the health insurance mandate penalty will work, and should I pay the Obamacare tax penalty? You can get a lot of these answers, alright, by going to www.aiadirectquote.com. And here's another question. Are you confused yet about Obamacare and what impact it'll have on you? We certainly cannot predict the outcome of any future legislation or litigation related to health care reform as described under Item 1, Business, Health Insurance Industry, and Market Opportunity. We expect healthcare reform to result in profound changes to the individual health insurance market and our business. To get a free quote on your health insurance, go to www.aiadirectquote.com.